Welcome to the Healthcare Authority presentation focusing on Apple Health Medicaid eligibility factors. In this presentation, we will cover the following topics: Post-eligibility review, or PER, eligibility reconsideration, reapplying after PER, program integrity, and resources. Post-eligibility review. What is a post-eligibility review, or PER? PER is the verification process completed by healthcare authority staff when the attestation of income is not compatible with information obtained through cross-matches and the cross-match shows the client may not be eligible. Eligibility for Magi-based Apple Health is based on self-attestation, which is accepted at the time of application or renewal. Income described as not compatible with federal and state cross-matches when the income an individual attested to is below the Medicaid standard, but the data sources show the income is above the Medicaid standard, or the data sources are not available. If an individual is active on Supplemental Nutrition Assistance Program, SNAP, or cash assistance through the Department of Social and Health Services, they might not have a PER even if income is not compatible. Take a moment to review this slide. Individuals' attestation is accepted at the time of the application or renewal. The information in the application is cross-matched with data sources. This determines whether a PER is needed, as you can see in this diagram. When an individual is not income eligible for Apple Health, the system determines eligibility for a qualified health plan with or without tax credits. Please take a moment to review this slide. Let's apply what we learned to a scenario. Scenario 1. Rose completes her Apple Health renewal and attests her income is $500 a month from her job, but the cross-match with Employment Security Department, ESD, shows that it is $1,200. No PER is needed because the cross-match completed with the data sources find income below the Apple Health income standard. Scenario 2. Jake reports that his income is $1,200 a month from his job, but the Employment Security Department cross-match shows that his income may be $1,850 a month. A PER is needed because the cross-match shows Jake's income may be above the Apple Health income standards. During a PER, healthcare authority staff check third-party sources prior to requesting verification. Third-party sources may include Employment Security Department and the work number, also known as Equifax or TOX. When healthcare authority is unable to verify income with third-party sources, a letter is sent to the primary applicant requesting at least 60 days of income verification. This letter is sent to only the primary applicant and any authorized representative who have permission to receive letters on the applicant's behalf. This is an example of an Apple Health Information Request Letter, pre-penned letter. This letter is generated automatically through the Washington Health Plan Finder. This is an example of a Washington Apple Health Information Request Letter sent to an individual. This letter gives examples of acceptable forms of verification an individual can submit depending on the income type. The letter includes the income request, types of verification, the submission deadline, and contact information. All letters can be viewed in the Washington Health Plan Finder Message Center the day after they are sent. Individuals are given 15 days to provide the requested information. Individuals can provide this information via email, fax, mail, and online. Individuals can provide documents online by signing into their account and uploading these documents to their document center. After the due date, healthcare eligibility staff check the document systems for the requested proof of income. If verification is not provided and staff still cannot verify the attestation eligibility is based on all information available, this may mean an individual could be eligible for a different program, including a premium-based program. If the requested information is not provided or verified income is over the standard, Apple Health coverage could terminate. Even if someone is over income, they still need to provide proof of income so eligibility for a qualified health plan can be determined. Individuals who do not respond are not eligible for other healthcare coverage. Here is an example of a termination letter sent to an individual when verification has not been provided and staff are unable to verify the individual's attested income. The letter includes what was requested, the date it was requested, and the date it was due. All letters can be viewed in the Washington Health Plan Finder Message Center the day after they are sent. Eligibility Reconsideration. Reconsideration for eligibility may occur if healthcare authority receives the requested information after the due date in the information request letter, but before the individual's Apple Health coverage has not ended. If HCA receives the requested information after the individual's coverage has ended, the individual will need to reapply for coverage. Let's go over some scenarios. Scenario 1. Rose renews her Apple Health on November 1st, and the information on her application is cross-matched with data provided by ESD and is found to be incompatible. Rose is now required to provide proof of her attested income, and a letter is generated requesting verification. She does not respond. After 15 days, HCA staff review her case and terminate her Apple Health coverage due to no response. Her benefits are scheduled to end December 31st. What is the outcome of this scenario? Rose will be eligible for reconsideration if she submits the requested documents prior to December 31st. Scenario 2. Jake applies for Apple Health on June 7th and the information he provided is cross-matched with ESD data and is found to be incompatible. Jake is now required to provide proof of his attested income, and a letter is generated requesting verification. He does not respond, and HCA staff cannot verify his attested income. His coverage will end July 31st. He submits verification after his Apple Health coverage ends. What is the outcome of this scenario? Jake is not eligible for reconsideration. HCA reviewed the requested verification after his coverage ended. Jake will need to reapply for Apple Health. Individuals can reapply online via phone or mobile application or by submitting a paper application. Reapplying following PER. After a PER is completed and coverage is closed, individuals have the option to reapply for Apple Health. However, self-attestation may not be accepted. When income is not automatically verified through data sources, coverage will be in pending status until HCA staff manually verify eligibility. Through data sources, Apple Health will be pended until the client provides proof of income and HCA staff review their eligibility. What does pending status mean? Pending status means that coverage is not approved or denied, but verification is needed before eligibility is determined. When individuals are in pending status, a letter is sent through the Washington Health Plan Finder requesting information to be submitted within 15 days. HCA eligibility staff will process the application after the due date. As we mentioned in slide 14, individuals can submit information via email, fax, mail, and online through Washington Health Plan Finder. This is an example of a letter requesting information following reapplication for Apple Health. The table displays what is needed for verification purposes. This is the second page of a letter requesting information following reapplication for Apple Health. It provides examples of the types of verification an individual can submit. Eligibility fraud. Insurance fraud is the intentional underreporting of income or misreporting of circumstances to qualify for insurance coverage. This may result in severe penalties for the assister, the provider, and the applicant. The penalties can include, but are not limited to, loss of coverage, provider referral to the Office of Program Integrity, termination of privileged user access in Washington Health Plan Finder, criminal prosecution under Washington state law. If you suspect someone is fraudulently reporting their circumstances to receive Washington Apple Health Medicaid coverage, please notify Washington Apple Health Eligibility Fraud. You can reach them either via phone, fax, mail, or email. And for more information, visit the link shown in this slide, HCA Medicaid Fraud Prevention. Resources. For more resources and training materials regarding Apple Health Medicaid, please visit the Healthcare Authority Training and Education webpage at the link shown on this slide. For community partners, Healthcare Authority has made available a team of eligibility policy representatives to provide assistance for questions regarding Medicaid eligibility and assistance with Washington Apple Health applications. These representatives are specific counties. Thanks for listening.